Welcome to our podcast, Rare Resilience. In this podcast, we aim to provide insights and support for the rare disease community, providing caregivers with guidance for those living with rare conditions. And we'll navigate the rare disease journey together, one episode at a time. We'll be speaking with those who have been touched by TANGO2 related deficiency disorder, a rare genetic disorder caused by changes in the TANGO2 gene. Those living with this disorder can experience episodes of acute and serious illness called metabolic crisis. Neurological problems, including intellectual delays and disability and developmental milestones, can also occur. TANGO2 deficiency can affect people very differently. There is currently no cure for the disorder, but research is underway to better understand and treat the disease. So whether you're seeking support as a caregiver, or here to learn about the intricacies of rare diseases, we're delighted you've joined us on this journey. Together, we'll navigate the challenges and triumphs of caregiving in the face of adversity. Special thanks to Horizon Therapeutics for funding this podcast and awarding the TANGO2 Research Foundation their Rare Is Global Advocate Grant, enabling us to produce this podcast series and develop educational resources to grow our offerings in support of the community. This episode is entitled Between Hope and Fear, Facing a Potential Diagnosis with New Pregnancy. I will be talking with Amanda and Jordan Taggart and David Longman. Amanda and Jordan are TANGO2 parents to 5-year-old son, Jake, who was diagnosed with TANGO2 deficiency disorder at age 2. Since then, they have tried to learn as much as possible they can about TANGO2 disease and how to care for a child with this disorder. Jordan leads sales for Vita Health, a virtual chronic care company, and Amanda has 15 years of experience as an elementary school teacher. As a family, they enjoy spending time together outdoors and at Lake Michigan, where they live in Chicago. David Longman is a dedicated father of 3 children living in Perth, Western Australia. His middle child, Erling, was diagnosed with TANGO2 deficiency disorder in 2019, sparking David's active involvement in the TANGO2 community. By profession, David is a science teacher, where he shares his passion for science with his students. He also plays a significant role within the TANGO2 community, serving as a board member of the foundation and chair of the outreach committee, working hard to raise awareness and support for individuals affected by TANGO2 deficiency disorder. David, Amanda, and Jordan, thank you so much for joining me today. Let's go ahead and dive right into it. Just real quickly, I wanted to talk about your experience and your desire to expand your family. So David, if you can go ahead and dive right into it and tell me if you always wanted to expand your family, and if so, or not.
Yeah, well, when Kate, my wife, and I got married, we always intended on having a relatively large family. We're not from huge families ourselves, but we're both from families of three children. And yeah, we always expected to have a large family of at least 3, probably 4 children. So it was always in the mix to expand our family after Erling was diagnosed as our second child. But it took us a while to sort of feel comfortable with that decision following his diagnosis, not knowing the risks associated with TANGO2 disease.
And how about you, Jordan, Amanda?
Similarly, we always planned on having 3, right? And we wanted to expand our family. We had reservations after Jake's diagnosis. It took us a while before we were comfortable thinking that we would be ready to move on and try again for another baby. But we at that point were in a good place and had a handle on Jake's diagnosis. And I feel like Jake was in a good place health-wise and he was stable. So at that point, right, then and I think for us personally, it was just a way for us to move on with life and do something that we had always planned on doing and always wanted for our family. So in a way, it was like a little part of our healing process to just move on with life and do something that we had always wanted.
Yeah, I think similar to David's family. It just took us some time to get there emotionally. and just be prepared for that again. But definitely something we always planned on doing and having 3.
That's great. And how did you say you mentally prepared yourself for the possible results of a possible Tango 2 diagnosis?
Yeah, it was it was definitely a process because we were weighing a lot of different options on how to proceed with having a 3rd baby. And I think most of all was thinking about kind of the control over the outcome was kind of like our guiding process, was really just kind of what can we have control over, that when you have a child with Tango 2, there's a lot of things that are out of your control. So we thought a lot about kind of what are the different options for working through having another baby. It's not the same as before, not having that knowledge. And so we had to really think about kind of what were the outcomes, what were the potential processes to get there, and then what were the risks, with any one of those kind of paths we took.
And
Yeah.
we had to think deep too, and there were a lot of talk about how it would affect our family dynamic, bringing another child into our life, into our family, how it would affect our relationship.
Mhm.
I was very worried about Jake, and I wanted to make sure our son with Tango 2, I wanted to make sure that he was very well taken care of, and he was always, our focus, and that was our priority, keeping him healthy. So we had to think about that dynamic of taking on another child, but also still really keeping Jake's care. What else did you want to add?
I mean, we talked about it a lot ourselves, but we are definitely ones to get opinions and support from our family and close friends. So part of like mentally preparing was also talking about it, not just with ourselves, but with others, and working through kind of our support process, which we lean on our family a lot, right, on a daily basis, for all sorts of support. So that was kind of part of it as well.
Yeah, that's wonderful. It's so important to have that community.
Mhm.
That's great. How about you, David?
Yeah, I mean, a lot of what they've said is similar to how I felt. When it was time, we kind of knew because both Kate and I felt like we had a handle on the situation. So, initially when Erling was first diagnosed, you don't really know what state you're in. You don't really know how you feel about, planning for the future. And once, we realized that Erling's disability is a real disability, but it's not something that's uncontrollable as a parent to live with, then we could feel more confident to start planning. And then you had to have a pretty honest look at the statistics. And it's not a very complex disorder to realize that you've got a 25% chance of having a child with Tango 2 disease, which sounds really high, but we did also have that optimism that if there's a 25% chance that you're going to have a kid with Tango 2 disease because you're both carriers, there's a 75% chance that you're not going to. So that was an important thing for us to realize, to keep that in perspective when we were trying, that it's more than likely a good outcome. And if it's a negative outcome, even though Erling can be very difficult and life as a disability parent is incomparably harder at times to life as a normie parent, there are aspects of Erling which are really worthwhile. And there's always the possibility that if our 3rd child, Mons, had Tango 2, that there were things that could be good about having another kid with Tango 2 in the house as well.
Spoken like a true science teacher with the statistics, right? But I love that perspective though, and I love thinking, okay, there was a 75% chance, and that's a positive way to look at it. And David, did you have any counseling offered by healthcare professionals? I know, Amanda and Jordan talked about how they relied on family and friends, and I'm assuming you did too, but I was just curious if you did the same, and if you were had anything offered from healthcare professionals.
Yeah, well, we did through the mainstream methods within Australia. Australia has a pretty good public health system, and once you've got a child that's diagnosed, there's pretty comprehensive genetic counselling which is offered. So they give you the sort of information on the risks, and then counsel you and offer counseling for, how you might feel about this. So it was offered to us. We never took up an extensive amount of therapy to sort of like guide us to the right decision. I think because, like we said, we'd already sort of come to the decision that, yeah, there are risks associated with this. There are opportunities for this to be a struggle for our life, but we think the benefits of trying for another kid outweigh the costs. So there was stuff offered specifically for understanding what your risk is, and then which we were well informed with, and then for offering some well-being support going along with that. And we never really took that up, though, besides talking amongst ourselves and our family.
Okay. And Amanda Jordan, how about you? Did you go to any professionals for additional help aside from help from family and friends?
Yeah, we actually sought out quite a bit of information because, again, we were determining kind of the process we wanted to go to try to have a third. And so we did a couple things in parallel. Like David said, we have in the States genetic counseling available through our own, private network of physicians and others. And that's where we started. We started with, honestly, the genetics team that helped diagnose Jake in the first place, and just started there and said, we're thinking about having a third. And then from there we got, really directed to family planning, genetic counseling, and then in parallel, Amanda,
In
started
parallel,
that
yeah, at the
process.
same time, I met with my doctors, and I think we just talked through the options, laid out the options and what each option had its risk and outcomes, and the implications of each. So we talked about natural pregnancy, and then we also actually pursued and talked about IVF for having our third.
Yeah, so we had a lot of inputs. I think we definitely had our own, like, I would say, private therapy process that we worked through together, right? Just kind of thinking about what the options were and how we were going to manage that. But, like David didn't really kind of seek that out externally. I think a lot of it was just kind of internal family and friends support about thinking about kind of what a third child would be like with the family, and then, what potential diagnosis would also involve, and how that would impact the family as well. So we did seek out a lot of support, genetic counseling, medical support, really just to kind of think about how to help us move forward.
Yeah. And given the new information on B vitamins being a treatment that seems to be improving the quality of life of those living with Tango 2 disease, do you see that as something that allowed you to approach the idea of a new baby with more optimism?
Yeah, for me, without a doubt. And, like when Mons, my third, was born, really the information about B vitamins being really effective therapies. Erling was already on B vitamins, like many of the Tango 2 kids, but we didn't really know the efficacy. And now we're quite certain that the efficacy is there, that it has really good effects the earlier that they start on it. So it would definitely make me more optimistic if, the child that if we had a child in the future that had a Tango 2 diagnosis, that we would have more power to do something about it to, improve their life immediately. Because I do remember, like obviously, well, part of the diagnostic odyssey when you have a new pregnancy with Tango 2 is they'll offer you some testing, and the testing that we opted for was called chorionic villus sampling. It's done around week 12, which is quite late in a pregnancy, and it means that you've probably got about 2 weeks of turnaround on the results as well. So by the time that you have the results, your child's 14 to 15 weeks old, and when the rubber hits the road, making the decision on, whether to terminate a pregnancy at that age would have been very difficult for us. And I don't know if we had been offered that, whether we would have gone through. Fortunately, Mons was, not affected. So what I'm trying to say is that decision probably would have been a lot easier with the knowledge that we currently have on B vitamins now.
Yeah.
But that was something that fortunately we didn't have to make that decision. But it was, there was a real fear associated with that from me and Kate at that time.
Right, of course. And how about you, Amanda and Jordan? Given the new information on B vitamins being a treatment that seems to be improving the quality of life, how would you approach a new baby with more optimism?
Yeah, I think similar to what David said, it was definitely changes the dynamic and how you think about the future with any child with Tango 2. Like David said, there's a lot of unknowns, when you start, but I think at least having one thing that you can point to provides a lot of comfort. It provides a lot of optimism about the future, and like B vitamins are that right now for all of our Tango 2 kids and parents, right? But I think, it helped us, but it also, didn't necessarily dictate for us that we wanted to go down kind of one path or another. We really evaluated that having another baby naturally or going through an IVF process. And I think going through the decision that David just talked about was part of, what enabled us to make that decision. So I think you specifically kind of talked to your doctor about the process David just talked about, when we'd have to make decisions, and eventually we decided to go down the IVF path because of that as well.
Yeah, I think for us, it just eliminated risk, and it eliminated that factor of having to be put in a hard spot and making a very difficult decision of whether we would be faced with terminating a pregnancy. Also, when I met with my doctor, the options were laid out for me. We talked about the CVS, like David mentioned, and we also talked about needing a test called an amniocentesis, which I think can be it can be invasive. And there's like a 1 out of 300, or maybe a 1 out of between that and 1 out of 500%, or 1 out of 500, in between 1 in 300 and 1 in 500. That's what I'm trying to say. Risk of miscarriage. So there was that risk there of losing, doing this test as an early diagnostic test to the pregnancy. There was a risk of losing a healthy, viable pregnancy. And then to me, on the other side, there was also the factor of being forced with a very difficult decision of possibly a pregnancy termination. And there was just a lot of emotion wrapped up in that. And for us personally, we felt like we were never going to be prepared to go through that and all that emotion wrapped up.
Mm-hmm.
So like Jordan said, just having less unknowns.
Mm-hmm.
So ultimately we decided to pursue IVF, which could do a pre-implantation diagnosis for that Tango 2 piece.
Right. Yeah. Thank you. And David, have all your other children been tested for genetic insight? Obviously, you have 3, so your daughter, have they been tested?
No. So Mons has been tested because that was part of the CVS, and obviously Erling, who has Tango 2 disease.
Right.
Both my wife and I have been tested, but Ingrid has not been tested. She's asymptomatic. She doesn't have any symptoms because she highly likely does not have Tango 2 disease. It's like nearly certain, because virtually everyone that has Tango 2 disease has some deficits, although there is starting to be some emerging evidence that some people have Tango 2 disease and are not affected. The reason that she hasn't been genetically tested is because the Australian government will only provide testing if a person displays symptoms of a disease. So we could pay for the testing ourselves, and it's something that we're considering doing in the future. or we could find a roundabout process to get her tested. And in the future, we probably will, but it hasn't been a huge priority for us at the moment, as we're very certain that she does not have Tango 2 disease. Yeah, but so we're not particularly fearful of that, but it would just be nice to know, especially for Ingrid, because she's likely to have children of her own one day, to sort of see at least if she's a carrier. It would be valuable information for her.
And Amanda and Jordan?
Yeah, we had, right when Jake was diagnosed, we did have our firstborn, Amelia, his older sister, tested, and we found out that she is a carrier. And then we have had our third EV tested. She was
Okay.
through the IVF process,
Mhm.
genetic, and she is also a carrier.
Got it. Okay.
Yeah, and then I think
Yes.
we talked to really all of our extended family, to David's point, just for family, planning purposes. Amanda's sister, other relatives, we don't know exactly which parents the gene was passed down from. So, I think just making everyone aware so they can test appropriately was really the path we just wanted to take. We had some females in the family that were thinking about starting to have families, and so we just wanted to inform them. And some of them have gone through the testing process, and some of them are thinking about how to do that. So it's we went through it just to, in like David said, sometimes it's a roundabout process to get the approval to do that. But we've done it with a number of our family members.
And that's a perfect segue to my next question, was really just, what advice do you have for other families out there thinking about having another child when they already have a child living with Tango 2 deficiency disorder?
Well, I think it is about weighing up the pros and cons. And something that I was planning on saying earlier, and then I forgot, was that, when we would talk about the risks of trying, there's also the benefits of trying. And as Jordan was saying off camera before we started recording, one of the important aspects of us trying for a child was to not be defined as a disability parent. If, like, we are disability parents, it's a huge part of my life, and I've got no problem with that. But there is this sort of like, there's a value in moving on and trying for to bring some normality to your home. And I think that it's beneficial to everybody. It's beneficial to my daughter to have a sibling that doesn't have a disability, that she's going to have as like a peer as she gets older. And it's really valuable to my son, for he's not the primary focus of the house a lot. This is Erling, so he's not as big a focus within the house, which can be a good thing for him, because his disability makes him such a focus in so many components of his life. And then in addition to this, Erling has the opportunity to kind of be like a leader to his younger brother. So it gives him something to sort of feel proud and feel some ownership over. So seeing all that sort of stuff in our house, even though it is chaotic, and no one's going to say that having another young child running around isn't more chaotic, because it is, but I do feel like it's had the intended benefit. So you'd have to weigh up the risks of, potentially having another child, having to deal with the real conundrum of family planning, and also the benefits, which can be really significant.
Man, and Jordan, I saw you look at each other when David said that it gives Erling a chance to be a leader. I'm assuming Jake is the same way, because I've seen pictures of him hugging his sweet little sister.
It's the best, just seeing, ditto on everything David said, but seeing Jake just really shine, and his strengths, like we have just seen his strengths, after he's now the big brother, doting, loving, he's, responsible and helpful, and all these things shine through. And he has really loved taking that on, and we just melt watching him with his little sister. So that has been just such a wonderful thing, for a blessing, such a blessing, and after deciding to expand our family. And we did want to see Jake be a big brother. So, but in terms of like offering a little like other advice, I think like for the process, for us specifically, it took a little longer, right? And things took a little longer only because we did pursue the IVF process, and it's more emotional this time, and just that things were going to be different.
Yeah, I think it's just being honest with yourself. Like this, as David said, it's okay to be. I think when you have a Tango 2 kid, I'm sure a lot of parents have experienced this. That kind of takes over your life. It takes attention away from things for your other kids. Takes attention away from your relationship with each other. It takes attention away from your own individuality too. So, and that's okay. But I think just knowing that, and just recognizing that is okay. And knowing that when you're ready, it's going to be different, I think is the point you were trying to make. Having a third child, just with the knowledge of having someone with Tango 2 in your family, is just going to be different. The process is going to be different, regardless of whether you decide to have a child naturally or go through IVF, or you decide not to have another child. It's just a different process, and that's okay. So I think just being aware of that is probably the thing I would say. Be patient and just be aware that it's not going to be maybe the same, experience that you had with, the kids prior to that. And that's okay. There's so much joy and like other benefits you just don't know that will come out of it. I thought what David said was really, really well said. And it just creates other opportunities in the family you probably wouldn't have had otherwise. So
That's wonderful. That's beautiful. Amanda, Jordan, David, I want to extend my appreciation to all of you for joining me today. It's your dedication to the community beyond this podcast, and it's so appreciated, and your willingness to share your story and insights today. It's going to provide guidance to caregivers, I have no doubt. It's a courageous story. It's insightful. It's very inspiring. So thank you. And to our listeners, thank you for tuning in to Rare Resilience, where we journey through the world of rare diseases with compassion and understanding. And in the upcoming episodes, we will delve into a variety of topics, including how to stay present amidst the chaos of being a caregiver, how clinicians stay positive while caring for their patients, and how to reduce and embrace well-being as a caregiver, among many other things. We will explore these important themes and continue to support and uplift the rare disease community. So join us next time as we continue to explore the triumphs and challenges of caregiving in the face of adversity. And until then, remember, resilience knows no bounds, and together we are stronger. Stay tuned and stay resilient.